I'm Peter Jones from the University of Cambridge in the UK, and clinically I work in an early intervention service called Cameo, and I do research regarding young people with at-risk mental states for psychosis. My work at the moment is about young people with at-risk mental states, and my views have changed a little bit because I think many young people come with some aspects of psychosis, some hallucinations, beliefs that are pulling them back, but many of them are really quite depressed and anxious, and we mustn't just worry about whether or not they will go on to develop a psychotic disorder, although of course that's very important, but we need to treat their depression, help their anxiety, and we believe that sometimes that will get them back on track and lower their risk of developing psychosis. The IEPA conference has always been interested in the importance of childhood trauma in establishing risk for psychosis in young people. But other conferences back in the 1990s really wouldn't have any truck with that at all. And the IEPA has always recognised the importance of that. And some of the work that's now going on with virtual reality and trying to model what parts of the environment are stressful for young people is really amazing, actually. In this conference, things have come a very long way. We have some of the most effective treatments in healthcare. We can get young people back on track, move on, back to a fulfilling life. And that's very different from public perception, the fears of young people themselves, and from a lot of my profession. Not just psychiatry actually, but across mental health professionals. They just don't realise how effective this is. I think that message that this works is important for getting young people to treatment earlier. We need to get that message out to them, their families, professionals, schools. We do quite a lot of work in schools and colleges, that there is a point to getting involved in early intervention.